discuss the rheumatic heart disease. Now, first of all, we are going to have a look at the scenario. Okay, how is the scenario going to appear in the exam? So, they are going to give you this whole criteria. Okay, they are going to give you either two major Jones criteria plus evidence of past streptococcal infection, or they are going to give you two minor plus one major. So, this is the diagnosis, how this is the diagnostic criteria, okay? Two major with evidence or two minor plus one major. So, in order to diagnose the scenario, you should know about this Jones criteria. So, this is the, you know, how are you, this is the requirement that either two major with evidence or two minor with one major. If one of these are given in the scenario, this is rheumatic heart disease. But now, what is major and what is minor? So, for major, there is a mnemonic that is cases. It has helped me a lot. Okay, C is for carditis. They are not going to directly say that the child has carditis. They are going to say in the scenario that the child has breathlessness or edema. We can say features of heart failure or arrhythmias, or the child, they can give you the symptoms of pericarditis, a friction rub, and any of those things, or a murmur. For endocarditis they can give you, so more classically they give you a murmur. Okay, they give you either they can give you a murmur for an acute rheumatic heart disease or for a chronic. So what is a murmur for acutely? We are going to have a mitral regurgitation murmur, which is a pansystolic murmur, and it is blowing in nature. Okay, and it is also known as a holosystolic murmur. And also in acute cases, this is for MCQ. Kerry-Coombs murmur is not given in scenario, but you should know, because Kerry-Coombs murmur and mitral stenosis murmur both are MDM, both are mid diastolic, so children can get confused. So they don't give. So this is what they give for scenario for acute, but you should also know about the Kerry-Coombs murmur, which is also a mid diastolic murmur, which also occurs in acute, and it is relieved. It is relieved as valvular edema is relieved, because it occurs because of valvular edema or valvulitis, you can say. And then in case of chronic cases, we are going to have the murmur of mitral stenosis, which is going to be mid diastolic murmur. They can also give you an aortic murmur, but mostly they give you a mitral murmur. So by the help of a murmur, you should be able to diagnose. Now, the next thing that is very important is, after the C we have the A. Now A is for arthritis. Okay, so what is the feature of arthritis in this case? There are three classical features. You should know these on your fingertips. There was also an MCQ. The arthritis is asymmetrical, number one. Number two, it involves the large joints. Okay, and asymmetrical. And number three, it is migratory. Migratory. So in scenario, they give you this migratory point. They always tell you that first it was in the knee, and then it was in the ankle. So the large joints are usually knee, elbow, wrist, and knee, and the ankle. Okay, so they give you one of these and they tell you that it is migratory. Then it is absolutely a diagnosis of rheumatic heart disease. But one more thing is that there was an MCQ that the in rheumatic heart disease, the arthritis involves option 1 large joints, option 2 small joints, option 3 small and large joints. Most of the students marked small and large joints, because in exam you get confused that maybe small joints are also included, but this is something you should know absolutely, that only large joints are included. This is, the marker is not working. Wait. Okay, so I was telling you that this is an MCQ point, that only large ones are involved. And now one more important point. This is the triad. Now you should remember that asymmetrical, large ones, and migratory. Any of these things can be given in scenario. Mostly in the essay question, they're going to give you the point of migratory arthritis, and you will easily be able to diagnose. Now, one more thing you should know is that this arthritis responds to aspirin. Okay, response to aspirin. This is very important. Okay, this is a theoretical point that you should know, that if it does not respond to aspirin, this arthritis fails to respond to aspirin, then the diagnosis is doubtful. maybe the diagnosis is wrong. This point is so important that if this does not occur, if it is not relieved by aspirin, if it is not improved, by aspirin, if it is refractory to aspirin, then maybe this is something else. This is not rheumatic heart disease. So this is how important the response to aspirin is. Okay. Now, after the A, we have the in cases, we have C, A, and an S. Now, S is for the subcutaneous nodules. Now, these subcutaneous nodules, they mostly they appear after 3 weeks, so they don't help us in diagnosis, but they can help us in confirming it, because diagnosis would have already been occurred. And these occur on the extensor surfaces, and they are basically mobile, and they are painless, and they are firm, and all these things about them. And then with E we have erythema marginatum. Erythema marginatum is basically a rash in which we have a red margin, and then pale area, and then again red margin, just like a target lesion. Okay, like a bullseye lesion. And this is not going to involve the face. Okay, and the face is not going to involve the other parts. So the other parts which are going to be involved, they include the trunk. Okay, they include the trunk, and they include the extremities, and they include the thighs, and yeah. So then with the last S in cases, we have the Sydenham chorea. Okay, so for Sydenham chorea, this appears after 3 months. Okay, after a very long time, it is a very delayed sign. And what happens in Sydenham chorea? It is also known as a signed White's dance. Okay, so basically they are going to be involuntary, purposeless movements of the limbs, and there's going to be explosive halting speech. Okay, the students forget about the speech. Speech is very important in this case, and also there's going to be emotional liability. Okay, the students only remember that Sydenham chorea is purposeless movements. This is something they have crammed since first year and second year. But the emotional liability and the explosive halting speech part is very important. Okay, and you have to keep the child in a quiet area, away from stimuli, and you have to give, for this you should remember, they ask you in MCQ that what is the treatment. You have to give haloperidol or benzodiazepine for this, any one of these for Sydenham's chorea. Okay, always remember this. So this was the cases, CASES. So this is how you're going to diagnose the scenario. We have discussed the major, then we're going to discuss the minor.